Hello friends, today we are going to revise mix high yield points of all medical subject. So first point is levosimendan. Levosimendan is the calcium sensitizer in myofilament. Calcium sensitizer in myofilament in the cardiac cell. Next one is the undescendant testis is the cryptorchidisms, and this is the risk factor for seminoma, that is germ cell tumor, and the histology is showing the fried egg appearance, okay. And it can metastasize to lungs, brain and GI tract. Seminoma is positive for KIT, OCT3 and 4 and podoplanine. Next one, the delirium. In the treatment of delirium with the haloperidol, patient can develop few complications just like fever, tachycardia, high BP, muscle stiffness, altered mental status, and increased creatinine phosphokinase. It means patient has developed neuroleptic malignant syndrome, NMS, neuroleptic malignant syndrome, and this is the life-threatening condition. And its treatment is dantrolene, bromocriptine, sometimes amantadine, and ECT. Next one, SSRI with a MAO inhibitor or lithium may cause too much up of serotonin. Plasma serotonin will be too much high in this condition. So this is known as the serotonin syndrome. The patient has these symptoms: diarrhea, restlessness, extreme agitation, hyperthermia, myoclonus, shivering, rigidity, CV collapse, and maybe death. Gastrocolic reflex. This is transmitted through ANS, through prevertebral sympathetic ganglia. Next one, patient is HIV positive and has to be on fixed drug combination, that is TLE, tenofovir, lamivudine and efavirenz. Next one, Nalagunda technique. Nalagunda technique is a use of lime and alum for defluoridation. Peutz-Jeghers syndrome is the hematomatous polyp of small intestine and melanosis of mouth and lips. It is germline defect in tumor suppressor serine threonine kinase STK11 and liver kinase B1 LKB1. The gene is located on chromosome 19. It is also associated with other cancer: breast, pancreas, testicle, thyroid carcinoma and carcinoma cervix. Next one is the placenta type of abnormal placenta. It can be sexcenturate. I am showing only the important one. This is the sexcenturate. This is the marginally attachment of cord. It is also known as Barthelor placenta and filamentous type. Next one, old age patient can, if it is presented with dementia, ataxia and urinary incontinence, with ventricles are enlarged and brain atrophy. The symptoms correlate with normal pressure hydrocephalus, and the treatment of this condition is a ventriculoperitoneal shunt. Next one, double bubble sign in X-ray is a duodenal atresia, and its association is with Down syndromes and maternal polyhydramnios. Next one, single palmar crease is one of the finding in Down syndrome. Next one, this procedure is the USG guided subclavian vein cannulation, and long-term cannulation for parental nutrition is this one, subclavian cannulation, and it has the maximum risk for pneumothorax. Next, so this is the Klippel-Feil syndrome. Klippel-Feil syndrome. It is the failure of a normal segmentation of cervical somites. It will cause fusion of two or more cervical vertebra. So we can see fusion here. We have the triad of the Klippel-Feil syndrome is the short neck, low posterior hairline, and limited range of neck mobility. Next one is the Weissenstein. Weissenstein, it is used for Yersinia pestis. It may cause bubonic plague. Next one is the maxillary fracture. Maxillary fracture. Type of maxillary fracture, it can be Lefort 1, 2 and 3. Lefort 1 is also known as the Guerin's fracture. It has a presentation of floating teeth and palate. Lefort 2 is the pyramidal fracture. So this one, pyramidal fracture, and it is presented. Its presentation is with CSF rhinorrhea. Lefort 3 is a craniofacial dysfunction. It also present with CSF rhinorrhea. Sorry. Next one, medical termination of pregnancy. It do not requires consent from both spouses. Platysma muscle. Platysma muscle is innervated by cervical branch of a facial nerve. The next one is the sunburn versus polymorphic light eruption and solar urticaria. Sunburn is a painful erythema, and after 4 to 7 days of sun exposure, patient will have scaling, desquamation and tanning. Polymorphic light eruption. It is delayed type hypersensitivity, means type 4. It is itchy eruption. It spares face and it develops a few hours later of sun exposures. Okay. solar urticaria. It is very acute presentation. It is presented with wheals and develops within minutes of sunlight exposure, and it disappears within 2 hours. The last point is the exudative retinal detachment. It is the fluid beneath retina, serous fluid actually. So it has the special sign known as shifting fluid sign. It is painless progressive loss of vision. So here is the picture of this serous fluid collection beneath retina, and shifting fluid sign is seen in this retinal detachment, and this is known as shifting due to change in head position. This pattern changes. So thank you very much.